Hello and welcome to the Empowering Family Caregivers Show, sponsored by eCareDiary.com. I'm your host, Susan Baida, co-founder of the website eCare Diary and your host of today's show. It is Friday, February 18th, and we have Amy Berman of the John A. Hartford Foundation. Welcome, Amy.
Thank you, Susan.
So the Hartford Foundation is well, you'll tell us a little bit more about that in a little bit. But Amy's role at the John A. Hartford Foundation is essentially she's responsible for developing very cost-effective approaches to improve the health of older adults. I think this is a wonderful cause, and I'm really anxious to hear more about that. She is also a registered nurse with 20 years of experience in home health. So she would know precisely what it is like from the inside and sort of on the ground, right?
Absolutely.
So Amy, welcome, and tell us a little bit about the John A. Hartford Foundation and why did they become interested in particularly this area of services for seniors?
Thank you, Susan. So the Hartford Foundation is the largest foundation in the nation that solely is focused on improving health and health care for older adults. We are a $500 million foundation located in New York City, and we've been around since 1929. We, right around the 1980s, we looked at what other foundations were doing, and we certainly knew about the aging demographic. And most of foundations were supporting things in education, supporting efforts around children, and there really was not attention on caregivers and, older adults, the families who are caring for them. And so we turned our attention toward this very important area, and that's all that we focus on.
That's fantastic, and I think it's reassuring to hear that there is support behind the services that are offered by senior care providers and home health agencies. Tell us, Amy, about your role specifically. I know that you develop cost-effective methods. What exactly, I think more specifically, tell us about that.
Sure. So the foundation, the bulk of what we do actually is preparing the workforce. So about 70% of geriatricians in this country have some funding or support from the foundation, geriatric nurses, geriatric social workers, all of the people who are caring for complex older adults.
Right.
But when you train people, the best and brightest, they go out into practice, and the environment does not support good care. So we work on developing models of care that improve health outcomes for older adults. So whether it's in the hospital, home care, nursing home, out there in the community, we work to see how are the ways in which care should be delivered that really are effective and affordable for older adults.
So on that note, we're going to talk now about care transitions, because that's really, I think, I know that we first, I didn't meet you directly. I think our events director, Polly Whitehorn, met you, or she saw you speak at the Geriatric Care Managers Conference here in New York back in October, and you spoke all about care transitions. Please share with our audience what exactly is care transition for patients.
Sure. So for the caregivers that are out there, the people that you love and that you care for will move to different settings of care over the course of their health, their illness. So they'll move from the hospital to home. They might go to rehab. And in all of these different settings, the way that information is handed off, the way that you're cared for during those periods of time, there are a lot of problems. Handoffs are not always good. The other problem is between the providers, the doctors and the nurses and the team, how they're caring for you. They may also not share information in a way that's supportive of your health. So you might go to a cardiologist and your primary care physician, and they may not share information, and that can also cause a safety issue.
Yes, and we were talking earlier about John and my experience with my father-in-law and him being discharged from the hospital after spending time in the emergency room as well, and being handed a packet of 100 or 200 documents referring us to a list of agencies and providers who could possibly help us, with his care at home. And I think we just kind of looked at ourselves and at the papers with, in awe of, where do we start, and, which are better than others. And, we kind of had to figure that all on our own. And it's very daunting for the caregiver.
It can be terribly daunting, and you don't even know where to begin.
Right.
So we're going to try to talk about some of those ways to do better during those transitions.
So tell us, what should one do to help loved ones be better prepared for that transition? What are some specific ways we can do that?
So I think it's important to know what happens when we don't do them correctly. About 1 in 5 older adults actually ends up back in the hospital because of a bad transition. About 1 in 5 actually will go back, and they haven't seen their doctor or the nurse. They haven't had follow-up. So there are certain things that we can do to help prevent these avoidable rehospitalizations, to bring people home and to make them safer. One of the big problems is around medication. And so when people go to different providers of care, different doctors, nurses, social workers, and they may get different kinds of prescriptions in these different settings, oftentimes people don't talk to each other. The healthcare team is not very team-like. And so that leaves the caregiver and also the patient in the position where they really need to be informing each person or each place along the way. So one basic thing that I would suggest to you is that information should always be in your pocketbook, your wallet. It should be, I don't care if it's pinned to somebody's chest as they're going out the door, but you have to have that information with you, because each setting oftentimes is unprepared for that. And we've looked at some national data around this, and in California, for example, we saw that older adults living in the community, somewhere between 50 and 60%, had duplicated medications. They were going to different providers and getting duplication, or they were getting medications that just weren't the right kinds of medication. So you really need to have that list and have each provider look at that list before they're prescribing the next thing along the way. Another thing that you can do is to go to one pharmacy to get all of your prescriptions filled. So if you go there, they can be looking at everything that you've gotten, and that's another way to be very, very helpful. But you need to be informed also about your health. Right. You need to know what they're provided for, and you need to be able to tell each person along the way not only what you've been prescribed, but really what you're taking.
Yes.
Not what they told you to take, but sometimes you're going to tweak that. We know that people out there might be taking Uncle Joe's medication X for something. It doesn't matter, whether it's right or wrong, but when you go to your provider, you need to be completely honest. And not just to be completely honest about the things that they prescribed you, but completely honest about what you're taking over the counter. You need to be proactive about sharing that information each step of the way.
Yeah, those are excellent tips. Thank you for that. I mean, it makes common sense, but I don't think many of us out there actually follow the practice of keeping everything in one place. So that's really great, and that's one of the reasons, actually that's one of the inspirations for the Care Diary on our website, the management tool, so that families can keep all this information in one place and print it out and bring it to their care provider, their doctors or nurses. And very critical point. Thank you for raising that. And I guess my next question is, I guess this is a question directed more for the professionals out there in our audience. Now, what should a family expect of one's, of their loved one's healthcare team? So the healthcare team being their doctors, their nurses, people involved in the care of their loved one during the whole transition process.
I think one thing that's very important for the healthcare professionals out there is that they need to be arming the patients and families to be proactive and to be very, very well informed. So I would say that the providers need to be able to tell people what are the red flags, what are the warning signs that everything is falling apart, so that at the earliest possible moment people are informed when they should be calling their physician. A lot of times healthcare providers might say, fever of 100.9, call your doctor. Well, based on your actual health, there probably are some very real indications that might be a little bit different than kind of the general things that they'll tell you. So physicians, nurses, whomever is caring for you within that team, they need to give you very, very real concrete things to be looking out for based on you. Not just general things, but based on you and your condition. The other thing is that they need to tell you what to do during office hours and what to do at 2 o'clock in the morning when something goes wrong. You need to get a sense if something is going wrong at 2 in the morning, they need to prepare you in advance to know whether you should be waiting till the next day. You really need to be well prepared because you do not want to end up back in the emergency room or the hospital. You want to know very clearly what things you can wait and what things you cannot wait on. So providers, you really need to prepare your patients much, much better because avoidable readmissions are sky high, cost the nation $17 billion in a single year. And I think it's the responsibility of providers to really inform better.
So these practices and these, I guess, these trainings that you do, that you and your department, your organization does, I mean, are really ways for the system in general to save a lot of money just by simple practices.
So we work with a number of organizations around the country and a number of leading researchers who are training people all over the country in different kinds of approaches. Approaches for people who work in the hospital, approaches for people who work in home care, approaches for primary care physicians and nurses. So there's a lot of education and training going out there in the healthcare workforce.
That's excellent. Phenomenal. Let's also talk now, switch gears a little bit and talk about, is there anything in healthcare reform to address care transitions right now?
Yes. So the healthcare reform legislation that was passed actually allotted $500 million toward a Care Transitions Act. So there will be some piloting of some work going on all over the country to look at improving health through improving care transitions, and all of this is focused on older adults and their families. So you'll be seeing that roll out later this year.
This is excellent. Thank you very much for joining us today, Amy. The information I think you've provided is very helpful to many caregivers as well as professionals out there, and the information, I think what we're going to do actually is include links in the description of this show that'll be available in archive after this taping is over to the various areas of the website from the John A. Hartford Foundation. So thank you again for joining us, and thank you to our audience for spending time with us today. Please join us next Friday, February 25th. Have a great weekend.
Bye.